So I'd like to introduce Luisa Paredes, who's going to be speaking on hypertension. Thank you so much, Dr. Paredes.
Thank you. Thank you guys for having me. I think I'm so happy to see so many familiar faces. Some are people that I've met here in this group. Some are family members, some are patients. So thrilled that so many of you could be here. As you know, I'm one of the resident doctors at Brigham and Women's Hospital, and I practice general medicine and primary care. And today I wanted to talk about a topic that's so common and so important, and that is high blood pressure, hypertension. So I'm gonna take a moment to share my screen and also to just share with you that this is a conversation and not a lecture. So I would love to hear from you, kind of what questions you have at any point. You can type them in the chat, you can unmute and just speak up. And I'm hoping to hear some stories and some of your input. And the reason why this is important is because you don't just get to learn from me, but we all get to learn from each other because we all have experiences in this. So let me just take a moment. Okay, so hopefully you can see my screen. Is everyone able to see my screen?
Yes. Yes.
Fantastic. And I'll have Mandy, just if you don't mind keeping an eye on the chat so that if questions come up, maybe you can read them out loud there, and folks, of course, unmute anytime. So before we even get started, I would love to hear or see a show of hands or a yes on the chat. Who in this group has either had hypertension themselves or know somebody with high blood pressure? Yeah, I see a lot of hands raising. We all know somebody or ourselves might have high blood pressure. And this is super, super common. Actually, about half of the US population has a diagnosis of high blood pressure, which is huge. It's about even men and women. Men have a little bit more than women, but overall it's close to 50-50. And out of that half of the US population, only about 1 in 4 people actually has good control of their blood pressure. So if your blood pressure is not very well controlled, don't worry, you're not alone. And I'm glad that you're here so that you can help yourself and you can help people you know get a better control of your pressures, okay? So let's get started. And before we talk about high blood pressure and how to control it, I think it's really important to think about what is high blood pressure in the first place. We talk about this thing that's a disease, but how does it happen and why does it happen? And I wanted to kind of show you kind of my understanding of it and how I think about it. So here's a human body, right? This could be a man, it could be a woman. In this case, happens to be a woman. But this is what we look like on the outside. And this is our inside. I mean, I'm erasing the bones and I'm taking away some organs. But in essence, we have a heart in the middle. And then you have a bunch of blood vessels that deliver blood all over your body to all of your organs. So the heart is the pump, and these blood vessels here that you see in blue and red are basically the channels through which the blood travels, and the blood gets pumped here, and you can see it goes up here, and it takes blood to your brain, it takes blood to your fingertips, it takes blood to your kidneys, to your toes. Everywhere in your body needs blood because the blood is nourishment. The blood has nutrients, the blood has oxygen that your body needs to live. So very much like a garden hose, and I want to just make an analogy so that we can think about it. Very much like a garden hose, as blood flows through your body in these vessels, it's like water kind of flowing through the garden hose. And in this case, the garden hose will be like the vessel, right? Here, the water is coming out at a nice, gentle pressure. Not too hard, not too soft, just right. And is watering this garden with delicate flowers. Similarly, in our bodies, the blood is traveling through these vessels and delivering and nourishing our different organs. Some of these organs include the brain, the kidneys, and the heart. So you could imagine if you have a nice, normal, gentle pressure, kind of like in this garden hose, your organs are receiving nourishment in a way that is proper and gentle and good. Much like these flowers, when they get water from this hose, it'll be appropriate and the flowers will get water. But if you were to kink or bend the garden hose, kind of like this picture, that water is coming out way too hard. So if you could imagine, if you put this garden hose and you try to water these delicate flowers at that pressure, that high pressure, those flowers are going to die. They're going to get damaged. So very much like that, in our bodies, if our vessels are tightened, are squeezed, are too tight, or are damaged, then the pressure is going to get really high, and it's going to deliver to these delicate organs, much like this really like strong stream, and cause damage to our organs. And that is the danger of high blood pressure. When the pressure is too high, it's not just a number, it's the fact that it's coming too strong on these organs and causing damage in the long term. And here's like a different example of it. I want you to focus your eyes here on where it says normal vessel. You have this vessel right here, it's nice and wide, blood is coming through it. When that vessel gets tight, the water or the blood flowing through it comes out a little too strong, a little too high. That is hypertension or high blood pressure. And in this big picture here, you can see that the blood flows here and it goes up to the brain. And if there's too much tightness or high blood pressure here, you can get a stroke from damage in the brain. You can get a heart attack from damage to your heart, or you could get kidney disease from damage to your kidneys. Does that make sense? Any questions about this at this point? Fantastic. So one question that comes up often, I think it's something that we all have some experience with, is how do we measure blood pressure? Anybody here have experience getting their blood pressure checked?
Yes.
Yeah. What has been your experience with blood pressures? Who's gotten their blood pressure checked recently? Can you explain kind of what they did to you?
I think that, well, I'm not sure if you're looking for, I think that I know if I'm nervous, then my blood pressure goes up, which doesn't help the situation at all.
Absolutely. And there, thank you for sharing, Tony. There are a lot of things that can make our blood pressure go up higher. And there's something called white coat hypertension, which is when your blood pressure goes up because you see your doctor, you're like, oh my God, I'm just worried that it's going to be high. And when you went to the doctor, what did they do? Like, what does that process look like? Do they have you stand up? Do they have you sit down?
I've had both ways. Typically, they have you sit down, stretch out your arm, they put the cuff on, put the stethoscope under the cuff and you know, check your blood pressure. Sometimes they use the automated one, which I don't exactly love. So is that what you're looking for?
Yeah, no, I'm looking for your experience, and that's absolutely right. There's no right, there's no wrong answer. I just want to hear what you guys have heard and then add on to that. And anybody have a blood pressure cuff at home? Yeah, it sounds like a couple people. I see Brenda, I see Sandra, a couple people have blood pressure cuffs at home. Do you guys have the one that goes on your wrist or on your arm? Both? Both. Perfect. I'm going to show you a little bit of both of those, but because there's a couple of different types of blood pressure cuffs. So going back to this, right? Let's see. Going back to this, there's a couple of tips for checking your blood pressure, and something that you'll notice that they do in the clinic when you go to, and I'm hoping that you also do at home, is a couple of tips to make sure that your blood pressure is actually reading appropriately, not coming up too high or too low. Like you said, Tony, sometimes it can be too high if you're nervous and other things. So here's a few tips. This man here in this picture is a great example of how to check your blood pressure. He has been sitting here for, first of all, for 5 minutes. So whenever you're checking your blood pressure, it's important that you're sitting down for 5 minutes and kind of breathing and relaxing so that you're not anxious and you're not stressed and you're not thinking about something else. So that is ideal to do. The other thing that he's doing really well is that he's sitting down on a chair where both his legs are touching the floor, his feet are touching the floor, and his back is resting. Sometimes if you're trying to have a good posture and you don't have a way to be comfortable, if your legs are dangling, that can give you a wrong reading. So it's important to make sure that you're in a comfortable position. The third thing that he's doing is that, as you can see in this picture, his arm is at the level of his heart, right? Is at the level of the chest. So the heart is somewhere around here in the chest. And you want to make sure that that blood pressure cuff is right there at the level of the chest or the heart, so that it gives you the best reading. And lastly, when that blood pressure cuff is inflating, we always want to make sure we're not talking during that time, because when you talk during that time, it can change the reading. Sometimes you talking, that takes more effort. It can push your blood pressure up when it's not supposed to be, and it gives you a wrong reading. Any other tips that you guys are familiar with to checking your blood pressure? Any other things that you do?
I drink a lot of water before I go to the doctor.
Beautiful. I love that, Verona. Staying hydrated. Sometimes if you're dehydrated, your blood pressure might actually show up a little too low, or your heart rate might be too fast or too, yeah. So making sure that you're nice and hydrated is important.
I find a few really deep breaths help before getting blood pressure taken.
Absolutely, Mandy. That's 100% right. Relaxing, taking in deep breaths, and trying to get everything that's on your mind away from you, so that you don't get nervous or anxious about what your blood pressure is going to be.
Quick question. If your feet are not flat on the ground, but your legs are crossed, how does that change it? Does it make it higher or lower, the reading?
I think it might make it a little bit higher. It depends, and I don't think it'll change it too much, but especially when you're checking it at home and it's already not very precise, it's best to do it as appropriately as possible. So when you cross your legs, that increases the pressure, it collapses. Remember, if you look at the picture back here, you have vessels, right, that are down here. And if you cross your legs, you'll be squeezing the vessels here, and the blood is going to be theoretically backing up a little bit. So it may alter the reading that you're getting. So it's best to have them flat on the ground so that all your vessels are open and things are flowing. Thank you for that question, Gaina. Any other questions or thoughts about or tips for how to check your blood pressure?
I find that when you have a meal, like eating breakfast or lunch prior to going to the doctor and getting your blood pressure checked helps a lot. Because with personal experience, I realized that when I go to the doctor and I haven't had a meal, my pressure is really low. So I'm not sure if that helps in some way.
Yeah, Luz, that's an excellent point. Making sure it very much depends on why you're going to the doctor. And sometimes when you're going to the doctor, they'll ask you to come in, if they're going to get labs or something like that, they might ask you to come in fasting. But if it's just a regular follow-up appointment, making sure that you're not uncomfortable, that you're not hungry or dehydrated is really important, so that one, you're able to focus, and two, you're able to get a good reading. Thank you for sharing that, Luz.
What about body temperature? Does body temperature, like whether you're hot or cold, affect the readings?
Good question. OCP. That's
Cherie, oh, Cherie, hi.
Oh, Cherie, welcome. That's a great question. I don't think that that necessarily will change your blood pressure reading. There's no studies that have shown that. What I can tell you is that whenever we're cold, and you may notice this, when you get really cold, your vessels clamp down. And you can see this because sometimes when you get cold, your fingertips get really white, etc. So your vessels clamp down, and theoretically your blood pressure could go up. So ideally, you're as comfortable as possible. You're not sweating and hot, you're not freezing and cold. You're just kind of at a comfortable position.
Someone is asking the connection between blood pressure, high or low, and A1C.
Great question, and we can talk a little bit about that. The A1C is a number that determines, or it helps measure the degree of diabetes that a person might have. So if you have a very high A1C, that means you probably have diabetes. And so people with diabetes typically end up having damage to their blood vessels. When your sugar levels are really high in your blood, that blood with a lot of sugar in it ends up traveling all through these vessels. And over time, that causes damage to the vessels. And if you have damage to the vessels, then that's going to damage or hurt your blood pressure. So it's very common if you have diabetes to also have high blood pressure, but it's not like the higher the A1C, the higher the blood pressure. It's not a direct correlation, but it's very common that those two things come together. Any other questions from the chat, Mandy? Perfect.
No
Fantastic.
others from the chat.
Great. So we'll move on, and I wanted just to take a moment to talk briefly about how the blood pressure check is checked. So we all have this experience, right? Where you go to the doctor or you do it yourself at home, you put in the cuff, and that cuff gets inflated and it just gets so tight. And then it relaxes. And sometimes it's a little scary, especially if you're doing it at CVS or some sort of pharmacy and you're like, wait, when is this thing going to stop squeezing my arm? But the reason, I wanted to take a second to explain the reason why it's squeezing. So here on this first arm, you can see the vessel coming down, and you have a bigger vessel closer, closer to your shoulder. And then that vessel splits as you come down into the kind of the hand and the fingers. You put your blood pressure cuff, and the machine inflates the cuff all the way until that artery, that vessel that's coming down, is completely collapsed. It's just trying to close all all blood flow down to the hand. And then it slowly, very slowly starts deflating and starts opening up. And what that does is that as the machine is deflating the cuff, it is measuring how much pressure does it take to pop this cuff open. How much pressure is it taking for the blood to get through the cuff? And that's how you get a blood pressure measurement. To talk about the devices, you can see here 2 of them. So as you know, in clinic, we have the one where we pump it ourselves and we take a listen to the stethoscope and we can hear the blood kind of flowing through, and that's how we know which number it is. The machines that are automatic can get a sensor that have sensors that give you the number without necessarily needing to listen. It sounds like some of you have the wrist one, some of you have the one that goes further up in the arm. Both are good. Generally speaking, we recommend the one that goes in the arm better. And the reason why is because if you go back up here to this picture of the arm, you see this vessel up here is nice and big. It's much bigger than these 2 little ones. So it's more accurate to get a reading from a vessel that's a little bit bigger, like the one up here, than a vessel that's a little bit smaller, like the one down here or on the wrist. So both are generally good. Sometimes one is easier than other to use. So whichever you have is probably okay. But if you're about to buy one or thinking about purchasing one, I would say that the one that goes higher in the arm is better. Unless there are people who have issues in the arms where they've had surgery or they have something else that doesn't allow them to wear the one in the arm. And if that's the case, then the one on the wrist works just fine. And the most important thing is to make sure that whenever you're getting a reading, that reading is accurate. And what are some ways that you might imagine you could confirm that the reading is accurate? For those of you who have blood pressure cuffs at home, how do you know that reading is right?
The average?
Yeah, that's perfect. Thank you so much for sharing that. Absolutely. So if you take it a bunch of times and every time you take it is about the same, chances are you're getting an accurate number. So getting a sense of the average. Thank you so much, Drew. Any other thoughts? How do other people know that their blood pressure cuff is working right? I'll tell you my trick. What I like to tell my patients is to just go ahead and bring it to the appointment. If I have a patient who's telling me, hey, I'm getting this reading at home, but when I come here, I get something else. I don't know what's going on. I think my blood pressure is better at home or something else. I tell them, just on your next appointment, go ahead and bring your machine and we'll compare it. I'll check it and then we'll check it with your machine, and then we'll see if there's just a difference on the machine or if it's just that your blood pressure is different when you're home. So always, if you feel like you don't trust your machine or you keep getting different readings or your averages are not kind of looking normal, then just bring it to your next appointment, and either your nurse or your doctor can help you kind of compare and see.
Quick question. There are also apps now with the phone that you can test your blood pressure, I believe, with your phone app. Do you recommend those or no?
I have not seen it. I have seen the apps that show you the heart rate, so how fast your heart is going, but I haven't seen it for blood pressure.
Oh, okay.
Yeah.
All right, maybe we need to check to make sure I'm doing it because I thought we were also doing blood pressure. Well, let me just double check to make sure I wasn't asking the wrong question. So you're saying that it's just for heart rate, not blood pressure.
The ones I have, first of all, there's no wrong questions. All the questions are right. But second of all, I have not seen, just because I haven't seen it doesn't mean it doesn't exist. But as far as I'm aware, there's only the ones for the heart rate. Because the heart rate, you can check it kind of like the pulse. So sometimes with the watches or with the phone, you can get a sense of that. Generally, to check a blood pressure, you have to be able to kind of squeeze a vessel and then open it back up. So I think it'd be, if anything, would be some sort of attachment to be able to read it. That's my understanding, but you know, technology is moving fast, so I'm sure we'll have an app for it before we know it.
Thank you for clarifying that.
You got it. You got it. Some additional tips that I wanted to share with you. So other things that can get your blood pressure kind of out of whack or the reading wrong is if it's not the right size. Like what if you get this cuff and it's just too tight, too small, too big? Believe it or not, there's multiple sizes for the wrist blood pressure cuffs. I think there's only one size fits all, but for the blood pressure cuffs that go on your forearm, like here, those come in different sizes. And it's really important to make sure that you have the correct size, because if it's too small for you, the blood pressure will come up high. And if it's too big for you, then the blood pressure will look like it's low when it's actually not low. So making sure that you have the right blood pressure cuff. So how do you know that the blood pressure that you have right now is actually appropriate for you? Well, a couple of things you want to check. Number one, as you see in this arm, you want to make sure that the blood pressure cuff takes up about 1/3 of the length, you know, over here between your elbow and your shoulder. So it should be covering most of your forearm, of your proximal arm. Okay, so that's the first thing, how wide it is. And then the second thing is that you want to make sure it goes completely around your arm and then kind of sticks. And just to zoom into this, when you look at the blood pressure cuff, there is a line inside of it that will say max, and then it's going to be a line like this. So look when you're attaching it that the line on one end is within or before the max line. If it's after the max line, then that means that's too small for you and you may need to change it. Maybe if you haven't bought one yet, one thing you can do is just measure how wide your arm is. Like the circumference, like you can see here, like measure the circle around your arm in the middle. And then once you know how much that measures, then you can read it in the box when you go to the pharmacy and you can make sure that it's appropriately, you know, big for your size of arm. Any questions about that? That might have been a little tricky. Great. And the other thing that we think about is it reading properly? And we kind of touched on this already, but I wanted to show you kind of this picture, and I would love to get a volunteer. This is what, for the most part, the screen is going to look like. Could I have a brave volunteer to read this blood pressure reading on this machine?
123/94 with a pulse rate of 123 beats per minute.
Oh my goodness, we have a very brave and very correct volunteer today. Absolutely, this is 123/94 and the heart rate is 123. So and I'll break this down because we always get two numbers when we check blood pressures. There's always the top number and the bottom number. And what each one of those numbers tells us is the blood pressure, obviously, but remember that the pump that pumps your blood throughout your body and creates that pressure is your heart. And so your heart works by opening up, filling with blood, and then squeezing tight and pushing that blood out. Opens up and then squeezes tight and pushes that blood out. So that's why you get two readings, because the heart is at two different states. So the top number is when the heart squeezes out and makes that pressure high. And then the bottom number is when the heart is relaxing. So this is why you get a top number and a bottom number. Both numbers are important. Most people have a very high top number and a so-so bottom number. But generally, whenever you take your blood pressure, you want to make sure that you record both of them. If you have a third number here on the screen, which some machines have a third number, some don't, most of them do, this is the heart rate down here. The heart rate is important. You don't always have to record it, but the heart rate is just additional information. It tells you how fast is your heart beating at this time. Any questions about that?
Hi, this is Dr. Randolph. I have a question. What happens when you're using the old-fashioned kind that has the dial?
Mm-hmm.
You don't get you don't get clear 3 numbers like you do with the digital.
That's right. Yeah. So for whenever we take the blood pressure manually, as we do in clinic, what we do is we only get the top number and the bottom number, right? We get the when the heart is squeezing and when the heart is relaxing. The third number we get whenever, the way we get the pulse is whenever we check here, either by checking your pulse on your wrist or just listening to your heart, and we count how many times your heart is beating over the span of a minute. And that's how we get your heart rate. So in clinic, that dial does not give you the heart rate. The heart rate we check ourselves manually by listening to your heart or feeling for your pulse on your wrist.
One more question. Could you explain how to properly read the dial? I'm sure after this, I'm going to go out and get a digital one, but still, if something goes wrong with the digital one and the old-fashioned one is in the house, how do you read the dial? Is it when the dial slows down? How do you know? You know what I'm saying?
Absolutely. That is a great question. And I can briefly explain it, but I think that for the most part, it's best and it's easiest to have an automatic one at home and recheck with your clinic or with your primary care doctor if you feel like you're not trusting that reading. Just because whenever you're checking your own blood pressure, it's really hard to do it with a dial one or with a regular blood pressure cuff. So somebody else would have to be checking it for you. So what you need is both the blood pressure cuff that comes with the cuff and the dial, and then it comes with a little pump that you inflate manually. And that's why you need 2 hands, so you can't be doing it for yourself. And the other thing you need is the stethoscope, so that you can place the stethoscope in your ears and make sure that you can hear. And so because we're doing manually, not with a machine, what we do is we inflate the cuff all the way until we can't hear a pulse anymore. And then you inflate it slowly until you hear it again. And that's how we can see. And wherever you hear the pulse and then you don't hear it again, that gives you a sense on the dial what your top number is and what your bottom number is. But I think it's a little bit tricky to explain over Zoom, and it may take some practice. So I would say it's best if you go home, if you go out of your way to buy one, it's best to have a digital one. And if you want to be extra sure, take it to your primary care doctor so that they can compare it and make sure it's reading well for you.
Thank you. I will get a digital one. Thank you.
Awesome. You're very welcome. You're very welcome. Any other questions before we move on?
I have a question, but it's not related to reading. Should I wait in?
Yeah, you can go ahead and share your question, and if it's better to answer it later in the presentation, I'll answer it later, but I'm happy to hear it now.
Okay, my question is it harmful to check your blood pressure too much? Is there a such thing as checking your blood pressure too much? Like maybe, for example, if you have a heart problem or for the elderly, and if so, how often should you check your blood pressure?
That is a great question, Oshri. And I think that it's a trap that we often fall into. Once we get this machine, we feel like, oh, I can check my blood pressure as often as I want. Like, I'm just going to check it every day, twice a day, 3 times a day. And I think it becomes a psychological game. So I think that in general, it's not good to check your blood pressure obsessively. Even every day may feel like a lot, unless your doctor is making changes to your medicines or you're not feeling well. I think checking it every couple of days just to keep an eye on it is good enough. Checking it too much is not going to damage your arm. It's not going to cause you any physical harm. But I think what it can create is this level of anxiety over what your blood pressure is at any point that can overall then make you anxious and rise your blood pressure because you're too worried about it. Does that make sense?
Okay, thank you.
Yeah.
So yeah, so it's not physically harmful, especially if you're like older or have heart problems. It's not.
No, it's not going to harm you. It just might create some anxiety. Ideally, you switch the arms every now and then, because if you squeeze it too much, you don't want to cause pain, etc. But it's never going to really cause you any significant harm.
Okay, thank you.
You're very welcome. All right. So we've talked all about reading the blood pressures and how to do it and how does it work, but what is a normal blood pressure? Anybody have any guesses or kind of can share their understanding of what a normal blood pressure might be?
So my understanding today, it's 120/80.
Beautiful. Yeah. So 120/80 is the gold standard, right? That's like in the green, what we want it to be. And that's absolutely right. And I don't want to overwhelm you with this chart because this has kind of all the ranges, but sorry. So I want you to keep your eyes here on the green. As you just mentioned, you have your top number 120, your bottom number 80. That's the ideal blood pressure. It could be a little bit lower than that. It could be a little bit higher than that. But in general, you want to be in that neighborhood. The higher you go, the more dangerous it is. Generally speaking, your doctor will start talking to you about high blood pressure if your pressures are here in this orange-red area. If it's greater than 130, or definitely if you're in the 140s, over 90s, your doctor will be checking in with you about the possibility of starting a medicine because it's starting to get on the danger side. If you get higher than 180s, or you're up there in the 180s over 120s, then that's actually a crisis, and it can be very dangerous, because if you go back to this analogy of the garden hose watering the garden, that's the equivalent of having a fire hose just in a garden destroying everything. Your organs are just getting bombarded with blood at a pressure that is way too high and can only cause damage. So if your pressures are getting in this red zone, definitely give your doctor a call and try to schedule an appointment. If you have blood pressure that is this high and you're having symptoms, then that may be a reason to go to the emergency department and get checked out. Questions about that?
I have another question.
Yeah.
The normal reading of the 120/80, is that normal for all races?
Yeah, that's our standard normal for all races. It doesn't change by race. But that I think brings out the point of, is that normal for all people, period? And generally, older people, the older you get, the higher your blood pressure will naturally be. So sometimes for older folks, doctors will allow a blood pressure that is a little bit higher, because the risk of fainting or having side effects is higher for older folks than younger. But yeah, we keep the same blood pressure standard for people who are white, Black, Hispanic, and all races. What do you have for that? Go ahead.
Question. I understand that what they look for is 120/80, but when I go to have my yearly or insurance, whatever, have my physicals, it's never really 120/80. I've never seen 120/80. Sometimes I do have the white coat syndrome, I believe. But normally it's like 131/78 or something like that. Sometimes because of the syndrome, it could be like 138. But truthfully, it doesn't really seem to bother the nurses. They say, "Oh, it's fine, it's good, it's good, it's good." So should I be like working toward that 120?
Yeah.
Consistent basis?
Very great question. And then that is so, so common. So you're not alone in this feeling like, hold on, but every time I go, it's a little higher than 120. Nobody ever told me anything.
Yeah,
And
exactly.
that is true. Very often, what ends up happening is a couple of things. Very often when you come to clinic, remember how we went through all the stages of like you sit down, you have your arm here, you are quiet for 5 minutes, you do all these things, and that gives you the ideal blood pressure, right? Very often in clinics, we don't do all of that. So we leave a little bit of wiggle room. If you're just in the neighborhood of the 120/80, we're like, yeah, it's okay. So there's some forgiveness there. It doesn't make it okay. And in general, you want to make sure that people are taking their time when they're checking your blood pressure. And the other thing is, remember, we want to be in the neighborhood of 120s over 80s. You don't need to be exactly in 120 over 80. So if you're 120 or under 130, you're probably okay. All right, if you're consistently in the 130s, 140s, then it may be a reason, there may be something that you bring up on your next visit and say, hey, can we look back at my records and see where my blood pressure has been? Because I've been told that, higher than this is, etc. And see if your doctor can explain to you why or why not they're worried or not worried about it. These are general rules, and there are people with specific diseases, like people with kidney disease, etc., who might want to have an even lower blood pressure. But your doctor knows you better than anyone else, right? Not better than yourself, but your doctor knows you better than maybe I do. So making sure that if you see that you've been getting consistently high numbers and nobody has brought it up, I would bring it up on the next visit and say, hey, I just wanted to check in about this, and if there's anything I can do. But nonetheless, we're going to go over some tips to keep your blood pressure in a normal range. And these are things that you should do regardless of whether your blood pressure is high or not. But certainly if your blood pressure has been a little bit higher, these things can help.
Thank you.
You're welcome.
People who are taller, is their blood pressure a little bit higher? Like if you were to 6'7", 6'8", like really taller people, is it naturally higher?
Yeah, I don't think so.
Okay.
Because the distribution, their heart should be proportionately, to their size, and it should be pumping as equally. So I don't think that that's the case.
Okay, because I was just like watching like National Geographic, and we're talking about, the animal with the highest blood pressure is the giraffe, because of the tallest, it has to go higher and so forth. So I was just curious if there was any translation with like how taller people are, especially when you're 6'7", 6'8", and so forth.
I love that.
A little bit higher.
Yeah, I love that. I haven't come across any studies that have looked necessarily at height. We typically, because people's heights don't vary that much, like we would be all very surprised if somebody's 7 feet tall that comes in my clinic, right? So because people's variations is not that great, I think we have a pretty good standard of what normal should be. So yeah, we don't change it by height, but that's a fun fact that giraffes have really high blood pressure. I guess their brains are really high up in the air, so you gotta make sure you pump it high enough. Yeah. I see that somebody has a question that it says iPhone, but you can feel free to unmute or enter your question.
Yes, I have a question. What is the difference between high and low blood pressure? Do they have the same risk?
Thank you for sharing that question. That is a great question. And you know what? They do in many ways. They can present very differently, but neither one are good. So if we were to go back here to our garden situation, right? You want to make sure that when you're watering your garden, which is, the blood pressure pumping through your vessels into your organs, you want to make sure that the pressure is not too high and not too low. If it's too high, it's going to damage your organs because it's just too much and it's just breaking through things, right? But if it's too low, your organs are just not getting enough blood. They're not getting enough nutrients, and you can still have the same consequences. The symptoms may be a little bit different. Like people with high blood pressure can have a headache. People with low blood pressure might just faint, or be really tired because their brain is not getting enough blood. So both of them are bad. You don't want to have either one of them. And both of them have consequences to your organs, to other organs. So it's important if blood pressure is too low, it's important to get it addressed as well. but low blood pressure is not as common as high blood pressure.
Thank you.
Dr. Paredes, there's also a question, what about people who always run high?
Yeah, so there are people who run high. Like I mentioned earlier, half of the US population has high blood pressure. And it very much depends on what high means, but for the most part, you want to make sure that you're in that normal range. If you're always running high, that means that you're always spraying your organs, hitting your organs with that high blood pressure. And you may not feel it, but your organs are feeling it. And over time, your organs will develop, conditions. So that's why many times you think you're doing great, right? And then you go to the doctor and they're like, oh, you have kidney disease. It's like, what? I never had kidney disease. What did I do? It's like, you didn't do anything. It's just that your blood pressure has been high for so long that your kidneys are now damaged. Or people will have, go through life and suddenly have a heart attack. You're like, what? Where did this heart attack come from? Well, you didn't feel it at all, but one day it just became too much because you were always high and then your heart couldn't take it anymore and it just, failed. So always running high, it shouldn't make you feel better. It doesn't mean that you need to go to the emergency department right now, but it means that you should talk to your doctor about what things you need to change so that your blood pressure can be in that normal range. Because even when you don't feel it, that high blood pressure is causing damage and it may hit you later on in a way that you might not expect.
I have a question.
Sure.
So does low iron affect your blood pressure? Like if your hands are always cold, does that
Good question. Not that I'm aware of. Low iron doesn't make your blood pressure high. Many times people with anemia or people who have significant blood loss will have a low iron and will have low blood pressure. So sometimes low iron can be associated with low blood pressure in people who have bleeding, but not with high blood pressure.
Okay.
All right. You guys have
I have another question.
Yes.
So you said half of the US, they have high blood pressure. My question is, does climate affect the blood pressure?
Does climate affect blood pressure? No, not that I'm aware of. Climate doesn't necessarily. There are people all over the world who have high blood pressure. The reason I say half of the US is because that's kind of the statistics I looked at from the CDC. Now I can tell you that within the United States, the southern United States, more people have high blood pressure than in the north. And some of the explanation for that is not because it's hotter, but it's because of the diet. The southern diet typically has a lot more salt and ends up causing more high blood pressure. But there are people in like warm climates and cold climates who also have high blood pressure.
You do have another question asking about best foods to eat to help lower blood pressure. I don't know if you're going to get into that later.
Love it. Yeah, let's move it right along. So we talked about this already, and we talked about what is normal. Before we get into the foods question, Luz, did you have another question before?
It's in relation to the food. I know that salty foods can cause high blood pressure, but is there something else that causes it? But you're kind of going to fall into that, so I'll just kind of wait.
Sounds good. Sounds good. We'll cover that, and then if there are any lingering questions after that, we can also answer them at that time. So, can you feel high blood pressure? Anybody ever felt when their pressure was high, or know somebody who felt it when their blood pressure was high?
Yes, I usually get a headache when my blood pressure is high.
Perfect. So headaches is a symptom of high blood pressure. Any other symptoms that you guys have heard of?
I sometimes feel like I can actually feel my blood pressure going up in a tense situation. Even if I'm just watching a football game or if I'm in a heated argument or something, I feel like I'm getting short of breath. I can almost feel like I can literally feel like my blood pressure is going up.
Mm-hmm, mm-hmm. Perfect. Thank you for sharing that, Tony. Anyone else?
Yes, I also feel like a pressure on the back of my neck.
Great. And as you can imagine, all these body parts that you guys have mentioned have blood vessels, right? We have vessels everywhere, and the pressure gets high in these vessels, they can project or manifest in ways that are a pain in those areas. But something that is important to highlight is, as I have it here, that most people don't feel it. Most people have very quiet, very high blood pressures, and they have no idea. And this is why it's so, so important to go to your doctor at least once a year so that they can check your blood pressure and you can keep an eye on it. Because it might go silent forever and you go on in life and you say, oh, I have no medical problems. That's because you never checked. And your blood pressure might be high for a long time, causing damage to those organs for a long time, and you never really felt it. Now, the symptoms that you guys mentioned are really important. And sometimes those feelings may be related to high blood pressure, and sometimes they may be related to your heart rate going up if you're like angry or anxious, or watching something that gives you, like energizes you. Or sometimes they could be for other reasons, and we think that it might be our blood pressure. But both blood pressure and not blood pressure things can cause those symptoms, and we'll go over those in a second. So just as a reminder, here's our outside body, and here are all the vessels all over our bodies. And essentially what's gonna hurt is whatever organ is getting damaged. So like you guys mentioned, if your blood pressure is so high that it's causing damage to your brain, then you're gonna feel a headache. You're gonna feel changes in your vision gets blurry. You might even get a stroke if your blood pressure gets very high. So it's not something lightly to take if you have a headache and you think is your blood pressure. It's worth checking your blood pressure at that time. And unless it's in the 180s or higher, chances are that headache might be from something else. But if you have a headache, or if you're having vision changes and your blood pressure is really high, that may be a reason to go to the emergency department. What if your heart is getting damaged? What might you feel?
Maybe chest pains?
Yeah, chest pains, and that's very common. And that's why people sometimes will go to the emergency department and say, oh my gosh, my chest is hurting. And they show up and they thought they were having a heart attack, but they caught it just in time and they were able to drop the blood pressure and they didn't truly have a heart attack. But if your blood pressure gets really high, it could get so high that it damages your heart and cause a heart attack. What about if your kidneys are getting damaged? How do you think you might feel that or notice that?
You have to go to the bathroom, have the urge to go to the bathroom more frequently.
Yeah, so the kidneys are another silent killer, where your kidneys they would have to get really, really damaged before you start noticing. But something that sometimes people will see is that they'll stop peeing, but more often than not, they just go to the doctor, they get their regular lab work, and then on their lab work, it shows up that their kidneys are not working properly. So this is one of those that can be really silent, and you won't notice it until it's too late, unless you get labs every so often. So something to pay attention to. And what about if you're having problems with your lungs? If your lungs are getting damaged from your blood pressure, what might you feel?
Maybe fatigue.
What was that?
Like, problem to breathe.
Yeah. So you could have a hard time breathing. You can have shortness of breath. You can feel like you can't breathe at all. And that's all because sometimes when your blood pressure gets really high, your lungs get flooded with inflammation from your blood pressure getting so high and your lungs getting damaged. One thing that I circled here is these vessels. And I circle these vessels just to highlight that all vessels can get damaged with high blood pressure. So not only are you hurting your organs when your blood pressure gets too high, but your vessels get damaged too. And these vessels could break and you can have a bleed, for example, or you could develop an aneurysm from the blood pressure being so high, etc. So something to be aware of, that all the vessels in your bodies can get damaged as well over time. And that's why it's not good to always run high, because when you always run high, you're slowly but surely causing damage that you're gonna feel eventually.
There's a question in the chat. Is it true some people can smell when their pressure is too high?
You know, I have not heard of that. But I will say that right now there's a lot of training of dogs for kind of smelling certain conditions and warning their owners about it. And I know that we have it for diabetes. I'm not 100% sure if we have it for high blood pressure, but I wouldn't be surprised if we do. So I've heard about something similar with dogs. I have not heard of folks kind of detecting it on themselves or on other people. Luz, I see you had a question.
I know you mentioned headaches being one of the symptoms of having high blood pressure. How about if you suffer from constant like migraines? Can that be a sign of having high blood pressure?
Yeah, so migraines have a little bit of a different physiology for how they work and how they cause pain. So typically not associated with it, although there are things that can trigger migraines. For some people, chocolate might be a trigger, coffee might be a trigger, and I'm sure for others, like having your blood pressure a little bit higher than usual can trigger a migraine, but they're not like interrelated that if I have a migraine, it's because my blood pressure is high every time. They're not as closely related. Tony.
Question. Oh, sorry. Go ahead, Tony.
Sorry.
So Dr. Ridker has told me several times that I have reached the age where it's time for me to stop shoveling. Can you speak about the risks of shoveling snow?
Uh-oh. I don't think I want to go against whatever Paul said. I think there are many risk factors for shoveling snow. Ideally, you live in a nice warm place where you don't have to shovel at all. But since we're in Boston, or most of us are, I think it very much depends on what you can do and what your body can tolerate. So it may be your knees, it may be just body aches, or it may be that you have heart problems. So there are certain levels of kind of exercise that everyone can tolerate. And if you already have heart problems, or if your blood pressure is already high and kind of hard to maintain controlled, doing a bunch of exercise like shoveling snow may tip you off and get you to a point where it might be dangerous. So I would follow whatever your cardiologist or your primary care doctor says if they know you well. Like they'll know you better than I do since I haven't taken care of you. But for different people, the levels of exercise that they can tolerate are different. And certainly exercising does raise your blood pressure naturally. That's why we always say sit down for 5 minutes before we check.
Thank you.
Gaina.
Sure. Do blood thinners, like including the baby aspirin, do they have an impact on blood pressure or no?
Yeah, no, they do not. So blood thinners, very much like their name describes, help thin out the blood so that you don't have clots, but they don't have much of an effect on the blood pressure. All right. Any other questions about the symptoms and signs of blood pressure?
Can you get chest pain with low?
Yeah, you can. So with low blood pressure, you can get a lot of the same things, but not as much damage to the vessels themselves, like over here, or issues with the lungs, but you can get headaches, you can get chest pain, because all these organs are just not getting enough blood. Your pressure is so low that it's just not enough getting there, and it's going to present with pain on the chest too.
Yeah, because usually my pressure is always not always low, but usually it's low. And I always get really tired, and I hear people saying, oh, when they get excited, they got headache and the high blood pressure goes up. Mine is the opposite. I get very sleepy, and I feel like I want to go to sleep when I feel like, have my.
And that's something that we can get with low blood pressure more than high blood pressure. And for that, it's really important to find out the reason why your blood pressure is getting low. And it could be things like bleeding, dehydration, anemia, and a number of things. And once you find out what it is, then there's going to be specific treatment for that. So if it's anemia, you might get iron. If it's that you're not eating and you're dehydrated, it means that you might have to take in a little bit more food, especially foods with a little bit more salt that will raise your blood pressure.
Thanks.
Great, you're welcome. So One question that whenever I tell my patients, oh, you have high blood pressure, people are like, but why? Why me? And there's a number of reasons why people get blood pressure. And I'm gonna just give you some hints here, and you guys can shout out what you think their cause might be for some people's blood pressures. What do you think this is hinting at?
So
Yes, sodium.
Yeah, too much salt. So if you eat foods with a lot of salt, that's gonna get your blood pressure up. So maybe something that if you have low blood pressure, this is something you can do to get it up. But for most people with high blood pressure, and this doesn't mean you should eat less salt. This doesn't mean that you should oh, just don't put extra salt in your food. This means look at everything that you're eating, and sometimes foods come with salt in them already. So if you buy the canned beans, that's preserved in kind of like salt water. If you buy fast food, the reason it's so tasty is because they put extra GMOs and extra salt in there that makes it taste so good. So just keeping an eye out for foods whenever you buy food outside of your house, whether it's fast food or even food from a restaurant, they will put more salt than is healthy. So keeping an eye on that is really important. What is this hinting at?
weight.
Yeah, so being overweight is a cause for high blood pressure. So making sure that you keep an eye on your weight and work towards a healthy weight is also important. And very often, as you lose weight, you will get better control of your blood pressure. So weight loss is a good strategy for getting your blood pressure better. What is this?
Age.
What was that?
Age?
Yes, beautiful. So with age, blood pressure gets higher. So as you get older, you know, it's just overuse. You've been using those organs, those vessels for a long time. And, you know, it's just natural that they will, you know, accumulate some damage over time. And the older you are, the higher your blood pressure.
So with that said, I'm a man of a certain age now. So mine might be just where it needs to be, huh? Is that?
It doesn't mean that that's where it needs to be. It just means that that's where it is.
Okay,
Just because it's a little higher doesn't make it okay, because it's still causing damage to those organs. But we are a little bit more flexible because as we get older, sometimes the risk and benefits of medicines, which we'll talk about in a little bit, we have to weigh those more carefully.
Gotcha. Thank you.
But the times when we're more careful about allowing pressures to run a little high is after the 70s, 80s. That's when we're like, oh, it's okay for it to be a little high. But if you're just in your 50s, 60s, even early 70s and you're fit and well, then I think we try to keep it low so that your organs can last as long as possible. All right, what do you think this one is about?
Drinking.
Yeah, drinking.
That's the hard fighting alcohol.
Yes, exactly. So alcohol use, and alcohol is going to fight your heart. It's going to raise your blood pressure. So keeping your alcohol use to a minimum is important. This one refers to family history. So if your mother, your father, or your grandparents have a history of high blood pressure, it's possible that this just runs in your genes, and you know, if you inherited that condition, and not much you can do about that. What about this one right here?
Too much
Caffeine.
Exactly, caffeine. And caffeine means coffee, it means sodas, it means tea. So anything with caffeine in it in general, it might raise your blood pressure. So keep an eye out for those things. What do these guys all have in common?
But I have a question. Why does it
Okay,
caffeine?
so that means no coquito, right?
So what was that?
No coquito, right?
I don't think coquito, if you're referring to the yes, if you're referring to the alcohol, ideally not keeping your alcohol consumption low. I heard another question right at the same time.
The other question I have, it was like, what about those people who always, it's running in the family, they always have high blood pressure?
Yeah, so regardless of the cause of high blood pressure, We're going to go over some of the things that you can do to keep your blood pressure low. But when you have a history of high blood pressure in your family, that makes it even more important that you avoid the salt and the caffeine and the overweight and all these other things, because it can only make it worse, number one. And then number two, it also makes it even more important that you keep an eye on that blood pressure, and you try to control it well, because it's possible that you're more likely to need medicine, even if when you change your lifestyle. But lifestyle changes are truly impressive and can always help improve your blood pressure.
And my other question for you is, why sometimes they say the coffee is good for you?
Why sometimes what?
They said coffee is good for you.
You know what? There's just so many studies on coffee, and they go back and forth. It's good for you, it's bad for you, it's good for you. We know that caffeine can raise your blood pressure. It doesn't mean you need to stop all caffeine. Most people drink maybe 1 cup a day or something like that, and that's fine. But they've done several studies, and some studies show it's good, some studies show it's bad. I think at the end of the day, as long as you don't do too much, it's probably safe.
Thank you.
All right, and I'll speed up a little bit. This is here, what these people have in common is that all of them are sitting down, not exercising. So having a sedentary lifestyle where you don't move a whole lot, that can raise your blood pressure as well, because those vessels are not getting exposed. Your heart is not working hard enough. It's like your heart is not getting really a workout and training. Here, does anybody recognize this photo?
Yes. Someone taking their blood sugar.
Yeah, exactly. So people with diabetes oftentimes tend to have high blood pressure. And this is to the question that came up earlier, that sometimes does A1C relate to your high blood pressure? And not necessarily one-to-one, but generally people who have diabetes tend to have high blood pressure too, just because those high sugars end up damaging your blood vessels. And lastly, this is a lady that hasn't gotten any sleep. So insomnia. Whenever you don't sleep well at night, that can over time cause issues with your blood pressure. So now, with the moment you all have been waiting for, I think we had like 2 questions lingering about what can I do to make my blood pressure normal or improve my blood pressure? And there's a couple of things, and we've kind of touched on them already, but one of them is just limiting the amount of alcohol you use. It's recommended that you don't drink more than 1 glass a day, ideally as little as possible, because more than that can lead to higher blood pressures. Exercise is another thing. Anybody have an idea of kind of the recommended amount of exercise?
"30 minutes a day."
Yeah, that's
15 to
right.
30.
So 30 minutes a day. I mean, ideally you do more, right? If you have time for more and energy for more, have at it. But studies show that 30 minutes a day, 5 days a week of you getting moving and getting your heart rate going, that is enough to help lower your risk of high blood pressure or to lower your blood pressure over time. So that's the recommended. It doesn't mean going to the gym or signing up for some fancy class. It just means moving your body, whether that means walking around the block a couple of times or doing some jumping jacks at home, whatever it takes, whatever your form of exercise can be, doing that for 30 minutes a day and getting your heart going for 30 minutes a day can make a big difference. I know that there are people who have knee pain and other things that can go out and walk. Then doing something with your hands, lifting weights many times or other forms of creative exercise can help. Because remember, you're trying to exercise your body and your heart, not necessarily trying to, become an athlete. This was referring to weight loss. Weight loss has been shown to help reduce blood pressure over time. So having a plan for what is your goal weight and by when do you want to reach that goal is helpful in reducing your blood pressure. Like we talked about, low salt. And then the question you guys had asked earlier, what foods are good to keep your blood pressure low? And to be honest with you, I think if you ask yourself a very simple question before you eat anything, that might give you the answer. And the question is, Does it come from a tree? I use this kind of thought in my mind all the time. Does it come from a tree? Chances are, if something came from a tree, it's probably going to be good for you, generally speaking, right? So vegetables, nuts, fruits, that kind of stuff, anything that came from a plant probably is going to be good for you, healthy for you. Ideally, things with extra fiber are also good for you. Things that are not great for you are pork, red meats, and anything that's very fatty. So even if you're getting like lean chicken breast, right, which is the better meat to eat because it has lower fat content. But even if you buy lean chicken breast, if you fry it, you're frying it in grease. So you're kind of going backwards. If you get broccoli, for example, but you fry the broccoli or you dip it in this, greasy sauce, then, you're kind of outweighing the neutralizing the benefits. So trying to eat foods that are as natural as possible is the best kind of type of food to eat. Oats, for example, people say, is oatmeal good for you, good for your blood pressure? Oats come from trees, right? From plants. So also a good food. What other questions are there around food? Because I know that has been kind of on your minds.
I have a question regarding exercise. I know you mentioned more like cardio-based exercise, but can yoga also be a form of an exercise that can potentially lower your blood pressure as well?
Yes, absolutely. And yoga helps your blood pressure in two ways. Yoga can help you relax and kind of help your breathing, but at the same time, yoga forces you to hold postures and positions in general that are actually a workout to your body. So it's not that some types of yoga are actually more speedy and less slow. But so yoga can be helpful, but the recommended is that 30 minutes of exercise, any exercise that will keep your heart rate going. So anything that makes your heart beat faster, that's the type of exercise you want to do for 30 minutes. So cardio better than yoga, but yoga is also helpful. All right. And then the last thing that can help, make your blood pressure normal is medications. And I know that this is everyone's least favorite thing, but sometimes it is necessary. So in the last 2 minutes that we have together, I just wanted to touch on medications and why it's important for some people. So when is it time to start medications? Well, it's time to start medications when your blood pressure has been greater than 140/90, at least in 2 separate occasions. So you come in, it's 140/90 or a little high. Your doctor may talk to you about it and talk about the different lifestyle changes that we discussed. And then they'll check again. When they check again the second time, if it's still high, it's safer to start a blood pressure medicine to get your blood pressure normal to prevent organ damage. And while you're still working on those lifestyle changes, because once you make those lifestyle changes and you make them part of your routine, maybe your blood pressure will be normal and we'll be able to take those medicines away. But it's better to wait less, because the less you wait, the sooner your blood pressure will be normal and the less time your organs will spend getting that high pressure that causes damage. And like I mentioned, ideally you have a chance to try those lifestyle changes. And if those lifestyle changes aren't changing your blood pressure quite yet, then it's a good time to start medicine. Sometimes it takes some time for us to get into the habit of working out every day or eating healthy every day. Some other reasons, sometimes if your doctor gets labs and they see that some of your organs are already damaged, that may be a time to just start a medicine from the beginning so that your organs don't get more damaged. And then once you've started the medicines, you're gonna need to recheck your blood pressure, at least in a couple of weeks to make sure that that medicine is working. For many people, we also like to check labs, to check your blood work to see how your organ function is going. We want to make sure we can see that kidney is recovering and other things are doing okay, or at least not getting worse. Some of the common side effects of medicines include swelling of the legs. Sometimes electrolytes can get out of whack, or sometimes your heart rate can get slow. These are all common side effects of some of the more common blood pressure medicines, but different medicines have different side effects. One thing I want to warn you about is that many medicines have many side effects. And it's terrifying when you go to the pharmacy and you get your pamphlet and you start reading and you're like, oh my God, this can give me all these things. And you're like, I'm not taking this. Your doctor will tell you about the more common things, right? And you are always in your right to ask, what are the side effects of this? And you should always ask, what are the side effects of these things? And we'll always tell you the common things. Because there's so much legal technicality and nobody wants to get sued, the pharmaceutical companies put every single thing they could possibly think of in those pamphlets so that they can say, oh, I share that information with the patient, you can't sue me. That's why they do that. But what ends up causing is it makes you worried and you just don't start taking your medicines. So if your doctor gives you a medicine and you get worried about the side effects because you read it, just call them up, make an appointment, even on the phone, and try to get clarification. Like, are these things really happening or not? Don't just not take it, because if you don't take it, that's again more time that your body is getting damage to your organs. And then just to end on a high note, you can get off your medicines eventually. Like once you make those changes in your lifestyle, not like, oh, I went in a diet for a month and now I'm good. No, you need to make small changes every day until they're part of your lifestyle. And over time, as you lose weight, as your body gets used to exercising, and as things continue to go in the right direction, then your blood pressure will start getting lower. And then we can start taking your blood pressure medicines one at a time. It's really important that when you're getting off your medicines, that you always talk to your doctor about how to stop them. Because the last thing you want to do is stop cold turkey. Like, oh, my blood pressure is good, I'm just going to stop. And then you stop, and then you go from having that gentle pressure to this fire hose onto your organs again. So the way we want to do it is start taking half, then less than that, then only 1, and then going from 3 to 2, from 2 to 1, et cetera, et cetera. So checking in with your doctor when you're ready to start taking away your blood pressure medicines.
That was great tonight. Thank you so much, Dr. Paredes.